Hello, everyone. Welcome back to the Road to Pregnancy podcast, where we provide you with pregnancy-related information and local, accessible resources here in Rhode Island. I'm one of your co-hosts, Malia Perales.
And I'm Ashley Houlihan. Thanks for joining us in our 8th episode. The past 7 episodes, we've talked about all things first trimester, including a general overview, preconception, nutrition, genetic testing, and nausea and vomiting. As we wrap up this first season of the podcast, we wanted to dedicate an entire episode to postpartum preparation.
That's right. People don't usually start talking about postpartum in the first trimester. You might be thinking, wait, I'm still nauseous. I can barely think about next week, let alone after the baby is here. But here's the thing, starting early means less stress later.
Exactly. It's good to start thinking a bit about postpartum, and we want this episode to be an introduction into that period so that it's less overwhelming later on. As a reminder, our main goal with the Road to Pregnancy podcast is to provide you all with a breakdown of the research and guidelines behind pregnancy-related information.
And not only that, but as we break things down, we'll also provide local Rhode Island resources that you can use to support you throughout this journey. So, the postpartum period. Let's start with the basics. Ashley, what does postpartum mean, and what is the 4th trimester?
So postpartum begins the moment the baby and placenta are delivered. Clinically, in the U.S., it's considered the first 12 weeks after birth, but as we'll talk about, full recovery can actually take up to a year.
Right. So even if your doctor clears you to resume normal physical activity at 6 weeks, that doesn't mean your body and mind are done healing. Hormones, energy, hair growth, even your menstrual cycles, they can all keep shifting for months. And this is what I wish more people knew. Postpartum isn't just about your physical body. It's about your emotional well-being, your relationships, your identity. There's this pressure to bounce back when, really, the goal should be to heal and adjust.
That's such an important message, and that's why it actually gets its own name. ACOG technically calls the first 12 weeks after delivery the 4th trimester. It's about recognizing that the transition after birth is intense for you and your baby, and you deserve continuous care during that time.
And that care includes mental health, physical healing, breastfeeding support, contraception, chronic condition management, and social support. Basically, your postpartum plan shouldn't be just a one-time 6-week checkup. It's much more than that.
Exactly. And that's why we want to talk about it with you now. We want to start planting the seeds so you can start thinking about what that period looks like for you, and we'll get more into some of the details of that.
So let's break down what actually happens physically during the postpartum period. Immediately postpartum, women commonly experience fatigue, pain, breast discomfort, and decreased sexual desire. Fatigue and pain are most pronounced in the first days and weeks, with pain generally resolving within 2 to 4 weeks after vaginal delivery and up to 3 to 4 weeks after a cesarean delivery.
The next big thing is involution. Involution is the medical term for when your uterus contracts and shrinks back to its pre-pregnancy size. That process begins after birth and continues for about 6 weeks or longer, depending on the person, and it typically feels like cramping. And picture how big your uterus gets when you're all the way through pregnancy and just think about how small it has to get back to. So that's the reason for some of the cramping and why it takes so long.
You'll also have some vaginal discharge and bleeding called lochia, which can last up to 6 weeks. This might be heavier directly postpartum, but will start to taper off over the course of the 6 weeks. And if you've had a C-section, you can still expect to have vaginal bleeding because the blood is coming from where the placenta detached inside of the uterus.
If you had a vaginal birth, you might be healing from a tear with some stitches or an episiotomy. If you had a C-section, you're healing from a major abdominal surgery. Either way, rest and gentle movements are key as your body heals these stitches.
And then there's the pelvic floor. The pelvic floor is a group of muscles and connective tissues that form a sling or a hammock across the bottom of the pelvis, supporting the pelvic organs. This support is important for things like continence, which is the ability to control movements of the bowels and the bladder, and sexual function as well. During pregnancy and delivery, those muscles take a lot of strain, and so during postpartum, people can experience urinary leakage, pelvic heaviness, or even prolapse.
What's prolapse?
Prolapse is when the organs, like the vagina, uterus, bladder, or rectum, drop down or sag from their normal positions within the pelvis. It doesn't sound good, but honestly, it's a lot more common than people think or even talk about.
Pelvic floor disorders like incontinence and prolapse are relatively common after pregnancy and childbirth, but the evidence is really clear that starting pelvic floor muscle training during pregnancy, even as early as the first trimester, reduces the risk of postpartum urinary incontinence by about half. And even if the training begins after delivery, there's still about a 1/3 reduction in risk. So the key takeaway is that starting earlier gives the greatest protection, but it's never too late to benefit.
Now, what does pelvic floor training actually look like? A lot of people know the term Kegels, which are the most basic form, basically tightening and lifting the pelvic muscles like you're trying to stop urine midstream. But it's more than just squeezing randomly. It's about learning how to hold the contraction, relax fully, and coordinate breathing. And that's where structured programs or guidance can make a huge difference.
And you may be wondering, where can people get guidance? Lucky for you, we have a good list of places. In Rhode Island, women can access free or low-cost support through programs like Women and Infants Hospital's pelvic floor physical therapy services. Community health centers like Providence Community Health Center and Thunder Miss Health Center also offer women's health services where patients can be connected with specialists. Additionally, Open Circle Rhode Island offers prenatal classes that include pelvic floor awareness and gentle exercises, and they offer 4 different payment tiers based on your income. And if you want a one-on-one approach, the Urban Perinatal Education Center can connect you with a doula or educator who incorporates movement and postpartum recovery planning into your prenatal visits.
There are also safe and free educational tools online. For example, the American College of Obstetricians and Gynecologists, or ACOG, and the National Health Service offer step-by-step guides and videos on pelvic floor training. The nonprofit Pelvic Health Foundation and platforms like Mayo Clinic also provide accredited instructional content. As always, we'll link all of these resources in the show notes. We'll also have an episode dedicated to all things pelvic floor in a later season, so stay tuned for that.
Okay, so we've talked about uterine changes, bleeding, and the pelvic floor, but there are other physical changes happening in the postpartum body too.
Right. For example, your breasts. Even if you don't plan on breastfeeding, your body still ramps up milk production because the hormone prolactin is high right after birth. And that means you can experience breast engorgement, leaking, and tenderness in those first couple of weeks. For some people, that discomfort improves quickly, but for others, it can be longer lasting.
Yeah, and then there's core. During pregnancy, your abdominal muscles stretch and thin out. After birth, it can take 4 to 6 months for those muscles to start regaining their strength and thickness. The good news is that gentle, low-impact exercises can really help you with recovery.
So, as you can see, recovery postpartum isn't linear by any means. It's variable, and it really fluctuates from person to person. And so, even though you may have previously thought that postpartum recovery is within that 6 to 8 week period until your provider clears you for physical activity, we want you to know that that isn't necessarily true, and your body will continue to change and heal well beyond that period.
And that's why ongoing support matters. Recovery is about recognizing that healing and rebuilding strength is a process that can take months, sometimes even a year. Starting to build your community and looking into resources and supports during pregnancy, even as early as your first trimester, can make a huge difference in your postpartum recovery.
Exactly. During this time, you can start looking into local postpartum doulas, thinking about nighttime baby care and division of labor, saving or budgeting for when baby gets here, and doing some of those pelvic floor exercises that we discussed earlier.
Making a plan for the weeks after delivery can actually be really helpful. We don't mean a specific rigid plan, but more so just an idea of what you want your postpartum period to look like. For example, you can ask yourself questions like, who's cooking or bringing meals? Who can help with the older kids or pets? What's the plan for night shifts? Which mental health supports are in place? And what's my plan for rest? It's important to keep in mind that things may shift and change throughout the course of your pregnancy, and that's okay. Keep this plan flexible as you move into your second and third trimesters, and we'll have an episode in the future that will talk all about postpartum expectations and setting a postpartum plan during the second trimester.
Ashley, those are great questions for our listeners to ask themselves as early as the first trimester. And going off of one of those questions, which mental health supports are in place, brings me to another point I really wanted to discuss in this episode: postpartum mental health.
Yes, that's really important to think about when discussing postpartum preparation. Malia, did you know that postpartum depression affects 1 in 7 birthing people? And postpartum anxiety is at least that common, maybe even more.
Yeah, they're very common. Being aware of some of the symptoms can help you recognize if you're experiencing that in your postpartum period. Some signs of postpartum depression include persistent sadness, hopelessness, guilt, loss of interest in the things that you enjoyed before, or trouble bonding with your baby.
And signs of postpartum anxiety include racing thoughts, intrusive worries about your baby's safety, and more physical symptoms like rapid heartbeat or shortness of breath. It can also include difficulty sleeping, even when the baby sleeps.
Now, we don't want you to worry too much about this right now because it can sound very overwhelming. But again, just being aware of these symptoms can help you recognize anything concerning later on. And we'll have a future episode all about this in a later season.
And I just wanted to add that I feel like some of these symptoms can be kind of normalized or expected for you to experience, like the concerns about your baby's safety. But some of these normalized symptoms aren't actually that normal, and there's lots of resources to get you the help that you need. So if you wanted to start looking into resources now or just have them in a note somewhere for the future, we have many options in Rhode Island. The Rhode Island chapter of the Postpartum Support International offers free virtual groups, peer mentors, and a resource directory for postpartum support.
There's also the National Maternal Mental Health Hotline that is open 24/7, and you can call at any point during or after your pregnancy if you're struggling. To access the hotline, call 1-833-943-5746.
The Rhode Island Department of Health has a page dedicated to perinatal mental health and discusses signs of depression and anxiety both during and after pregnancy. There are also resources listed on the webpage on how to get help.
And if you've struggled with anxiety or depression before pregnancy, starting mental health check-ins now during your first trimester can help you catch any changes early postpartum. We encourage you to talk to your provider about mental health as a normalized part of pregnancy and postpartum care.
Okay, so today we covered a big overview of early pregnancy postpartum preparation, from physical recovery and pelvic floor health to planning for support and being mindful of mental health.
Yeah, and our hope is that even if you're still early in pregnancy, you can start thinking about postpartum in small, manageable ways. It doesn't have to feel overwhelming, just little steps now can make a big difference later.
Exactly. Remember, healing takes time. Your postpartum experience is unique, and there's no one right way to do it. What matters is having support, resources, and giving yourself permission to recover at your own pace. Don't compare yourself to others.
If you're looking for local help, please check out the resources that we mentioned today. We'll have all of the links in our show notes.
And don't forget the national resources too, like the Maternal Mental Health Hotline. How about you save the number in your phone now, just in case you or someone you love ever needs it. The number is 1-833-943-5746.
And again, the hotline is open 24/7 for you during or after pregnancy. Thank you all so much for joining us today and for being with us through this first season of Road to Pregnancy.
We'll be back very soon with Season 2, where we'll dive into the second trimester, covering what to expect and continuing to connect you with evidence-based information and local Rhode Island resources.
Until then, take care of yourselves and remember, you're not alone on this journey. See you next time.